This comes as health officials continue to closely monitor the new Omicron subvariant called BA.2. While it's spreading quickly, it doesn't appear to be as deadly. However, there are concerns about the subvariant's impact on the number of cases. Gordon Severson has more on that.
First of all, why are we calling this a subvariant and not a variant?
And I don't actually know why they've chosen that language.
Dr. Hannah Lickson at Hennepin Healthcare says it's definitely confusing. Up until now, we've had variants from Delta to Omicron. Now we're hearing about a subvariant, a variation of Omicron.
The WHO has not yet labeled BA.2 as a variant of concern. They still might. When they do that, or if they do that, that's when it would potentially get its own name.
So what exactly do we know about this subvariant with no name?
Its risk of making people very sick is similar to that of Omicron. Scientists believe that the vaccines will be just as effective against it. It is also very similar to Omicron in that it is much more contagious than any variants we've seen before. And in fact, it is more contagious, about 1.5 times more contagious than the original Omicron strain.
How might this affect the peak of Omicron and when cases start to go back down?
Yeah, and at this point, it's too early to tell whether it slows down the downslope or creates a second peak. It certainly will extend this wave out.
Lickson says it's too early to predict if the subvariant will extend things out a week or two or a month or two. She says experts aren't overly concerned about the new subvariant, but they're watching it closely to see how it will affect this ongoing Omicron wave.
This is no more deadly than the original Omicron. It just means that we're stuck with Omicron for a little bit longer.
Gordon Severson, KARE 11 News.
The Minnesota Department of Health says so far no Minnesotans have tested positive for this new subvariant, though it has been detected in 26 states.